morning, Adam. Welcome to Healthtech with Purpose.
Thank you. Happy to be here.
Awesome. So, how's the day going and how's him so far?
Well, it's my first time at HIMSS, so I'll be honest, it's a little bit overwhelming, the size and scale, but no, it's been great. Spent yesterday, at the physician forum all day, meeting with colleagues and listening to some great conversation.
Awesome. So, to start with, Adam, can you introduce yourself a bit more and what you are doing? Just would like to know more of it.
Yeah, of course. Yeah, so my name's Adam Carewe. I'm a family physician by clinical training, and I serve as the Chief Medical Informatics Officer for Kaiser Permanente in the Colorado region. So, my role, the CMIO role can vary, across the spectrum, and so my primary role is being that kind of liaison between our clinical teams that are delivering care on the front lines and our IT teams that are helping to put together solutions, to help. So I see myself as this kind of conduit between them, helping. Those are kind of like my primary business partners, with obviously the patient being the one at the center and the one that we're always working towards. But that's my role in KP. I also work with a variety of different, CMIOs and other physician IT leaders kind of across the whole enterprise of Kaiser Permanente as well.
Nice.
So get to work across different states and, see what they're doing and leverage, some of that sharing across our enterprise.
Yeah, that's great to know. So, from a Kaiser Permanente perspective, can you explain a bit more about, what's the goal, mission of the organization?
Yeah, so Kaiser Permanente is a fully integrated system. So it's the full care delivery system and the health plan, the insurance product. So really the nice thing about care in KP is that you come into a KP facility or you get care in a KP facility and you can get everything done there.
Oh, nice.
We have in-house pharmacy, laboratory, radiology services, as well as all the traditional kind of care. So really, it's a value-based organization, that is mission-driven and really trying to just deliver care to those communities that we represent.
Got it. That's amazing. So, in this day-to-day, offering services to the patient and taking care of patients and all these things, what are some of the key challenges, that you face?
Yeah, we face, I think, the same key challenges that all, healthcare organizations are right now. I think to kind of like zoom out a little bit, I think the primary motivation of KP is to really provide and give really good access to care while also being super, super good quality.
Yeah.
And so that's kind of the foundation. And, but with healthcare consumers, there's a wide variety of ways they want to interact with the system. So I think our biggest challenge, or one of our big challenges in Colorado is making sure we have choices available to consumers to be able to access care in our system. And for folks that want to come in for a face-to-face visit, we have to provide that accessibility. Those that want to just connect digitally, either through some sort of synchronous or asynchronous way, we want to give them those options. I think the biggest challenge with having a potpourri of options is it's tough to, you don't want to limit choice, but you want to hopefully get that patient kind of nudged in the one that's kind of the most appropriate for their concern.
Yeah.
Because all they want is their answer or their concern answered. And so I think that is a challenge. That's, you could call it like care navigation. That sort of thing. That's front and center, with all the different options that we try to offer.
One of the things that I have been, when I'm talking to a lot of professionals in the health tech space, one of the challenges that came up, was lack of availability of resources in terms of the talent, in terms of clinicians, nurses, etc. Are you facing something similar as well with KB?
Yeah, I mean, in Colorado, we're not immune to that as well. I mean, I think the healthcare landscape is tough, and I think the history of people go into healthcare for a purpose. They really want to help the patient, and then I think so. Whether you're a physician or a nurse or any other kind of clinician that's helping deliver care, I think you enter the field with that mindset, and then I think when you get into the field, there's a whole host of things that you were not necessarily aware of, and I think that's what's kind of piled up over time, with regulations and things we have to do as a part of the systems we work in. And so that's why I think a big focus going forward is we always talk about the software, the hardware. I think a big focus going forward is like focusing on the people. And I guess you could call it peopleware, but getting back to supporting those frontline care teams, with the best tools that are easy to use and tries to not inhibit their day so they can take care of the people, and the technology can be as frictionless as possible.
Awesome. So, on that note, what's the role of technology you feel, and how is it helping take it to the next level?
Yeah, I mean, technology is interesting. I mean, I've heard several people say this yesterday too, so it's not an original thought, but the technology part is actually probably the easiest piece in healthcare, because you can figure out how to get it in the system, how to get it in place. The challenge is that triangle of the people and the process, and so you have to all three of those work in concert.
Yeah.
And I'd say the process is probably the part that is the hardest, because you got to get the appropriate folks behind this technology and what it's going to do, and that's primarily what an informaticist serves. To kind of be that liaison. And again, fortunately, I think being in the system that I'm in, that's integrated, it's a single medical group, that represented. So it makes it easier to get kind of buy-in for those things. But that still, I would say you have to have all three of those things.
Yeah.
And and obviously I love technology. I love consumer technology. I love healthcare technology. I think it's a means to get back to that happy place.
Yeah.
Where it eliminates those kind of arduous tasks that we have to do that are a part of care delivery.
Yeah, and as you mentioned, you are kind of making sure that the whole tech space as well as the whole medical space is kind of bridged in such a way that the organization leverages from it, right? So I think that's a very key role, right? And you must be getting to know challenges on both sides of the world. So with that, what's one of the most difficult integration pieces you feel, that probably it's needed, but it's difficult to explain, say, to the medical world. So any such example?
Yeah, I mean, I think there's a few. I think the one that's kind of complex because of the nature of the systems is how information is exchanged, so when patients are seen outside of our system, and how to get that in. And, because to a frontline care team, they just want to see that information in the medical record. They want to see that EKG that was done at an outside facility. They want to, see the report, or ideally the image of, sort of a radiology study that's done. And so I think the challenge was all these, the EMR systems weren't initially built for that interoperability.
Yeah.
I always give the example, which again, it's not an original idea, but I give the example of a plug. No matter where you go in the world, we have different plug standards in some parts of the world, but you can take your electronic device, and if you have the appropriate adapter or plug, it's going to fit in. And the healthcare systems weren't built that way to start. And so now we're having to do all this retrofitting. And so I see that HIE space as kind of that magic sauce on the back end that can hopefully get this information, into the systems, so people can have that information at their fingertips, and they don't have to be culling through faxes or, these old kind of archaic ways of getting information.
Interesting. And the plug analogy is really good because that kind of, in a very simple way, explains the interoperability problem that everybody is trying to solve now.
Yeah, I'm not an electrician, but I always give that example because I think everyone can understand it.
Yeah, that's really nice. And what's your take on AI? And yesterday I heard a really nice term, responsible AI, right?
Yeah.
So what's your take on the whole AI, the whole Chat GPT, and what's not happening in the AI world?
Yeah, I mean, obviously, from just a pure kind of techie standpoint, super, excited about it, and I think with any of these things, I consider myself on that fringe kind of early adopter status. So I'm always wanting to